This is a health and wellness promotion initiative between the University of North Dakota School of Medicine and Health Sciences and the North Dakota Department of Health and Human Services. My name is Dr. Grace Kakari. I am with the UND School of Medicine and Health Sciences, and please meet my co-host.
Hello, I am Grace Njau, and I am with the North Dakota Department of Health and Human Services. This month, we are extremely privileged to have Amy Keller join us to talk about the new North Dakota Cervical Cancer Awareness Toolkit. So, Amy, why don't you start by telling us a little bit about yourself and the work that you do?
Sure. So my name is Amy Keller. I am the Priority Populations Outreach Coordinator with the Women's Way program. So my role is really helping out to reach women and providing education on the importance of breast and cervical cancer screenings in North Dakota.
So January being Cervical Cancer Awareness Month, why don't you just start by telling us, why is cervical cancer awareness so important? Why does it deserve this month of focus?
Absolutely. So cervical cancer can actually be prevented with regular screenings like the Pap test and HPV test. And if abnormal cells are found, they can be treated before cancer even develops. So it's important to get those screenings, and it's important to start the conversation with your healthcare provider and know at what age when you should begin routine screenings and how often to screen. In general, most women should begin screening at the age of 21 with the Pap test, and that's every 3 years. And then once they turn 30, they can get a HPV and Pap test, which then the screening is every 5 years. So just telling individuals the importance of screening and when they should be screening is very important to preventing cancer, cervical cancer.
You did mention screenings, encouraging people to screen. Are there other things that can be done in terms of prevention?
Absolutely. So almost all cervical cancer is caused by the human papillomavirus, so HPV. So it's really important to stay up to date on your HPV vaccine series as well, as this is very crucial in preventing cervical cancer. Also maintaining a healthy diet, exercising, limiting your alcohol use, not smoking or using tobacco products can also help prevent cervical cancer.
For a cancer that's obviously vaccine preventable, I think one of the great advantages we have as a small state is that we do have very small numbers, as I understand it. Is that correct?
That is correct, yes.
And probably the only way to keep it as low is to essentially ensure that we are obviously staying up to date with the screenings and obviously the vaccines and early treatment as well. But let's get into the toolkit. So what is the toolkit, and why now? What is the significance of launching it at this point in time?
So yeah, the Cervical Cancer Toolkit is a collaboration of outreach resources for the community to utilize in promoting cervical cancer awareness and providing education. So the toolkit includes multiple resources such as videos, newspaper ads, different articles, radio ads, posters, and even a testimonial from a local cervical cancer survivor here in North Dakota. So the toolkit was developed in response to the need for our partners and their request to have a centrally located cervical awareness toolkit or resources for them. So since we had a great response from our breast cancer toolkit, we anticipate that this cervical cancer toolkit will also be widely used. And the toolkits really just provide a quick, easy, and efficient way for our community members to share information about the importance of cervical cancer screening.
So how can community members access this toolkit?
So right now the toolkit can be accessed on our Women's Way website. You just go to hhs.nd.gov/Women's Way, and then you'll just want to scroll down to the Building Community Stronger Together tile, and you'll be able to find the toolkit right on that page.
Excellent. Thanks, Amy. And then in terms of other resources that may be available, when you think about cervical cancer in North Dakota, are there any other resources that you can think of that people should be aware of, either through your program or other programs?
So yeah, if costs are a concern, Women's Way may provide a way to pay for cervical cancer screenings. So individuals can visit our website again at hhs.nd.gov/Women's Way to see if they are eligible, or they can contact us directly at 800-449-6636, and they can talk to a Women's Way local coordinator about what services are available to them if they are eligible.
is the toolkit free for community members?
Absolutely, yep. So the toolkit is free, and when you access the toolkit online, you can just download all the resources that are available. So if you want to access like a poster, you're able to download that file and then just print it internally. So it's completely free and accessible to all community members. If you would need these resources printed and mailed or delivered to you, you can outreach Women's Way by giving us a call. Also on our website, there is a online order request form. So any of the resources that Women's Way has available for community members can actually be ordered online. And that link is also provided in our toolkit. So you can click on that link and we are able to print and mail those resources directly to our partners or community members.
Are there any other general recommendations that you have for anyone who might be watching this and they're in North Dakota and curious about cervical cancer or the Women's Way program, or any of the information that you shared today?
Sure. So yeah, we're really just encouraging people to talk to their healthcare providers about the HPV vaccine if it's right for you or your child, as most cervical cancers are caused by HPV, and this can drastically reduce your risk for cervical cancer. And we're also, again, encouraging people to make sure they're up to date on their PAP and HPV tests, as these are crucial to finding cancer at its earliest, most treatable stage. Unfortunately, symptoms of cervical cancer typically don't appear until the cancer becomes larger and grows into nearby tissue. So this means that screenings are crucial in detecting cancer early. So if you have any additional questions, you can contact Women's Way at 701-328-3398, or again, just visit our website, as there's a lot of information and resources available to you on the website.
Are there some questions people usually ask you, and questions you wish you were answering to the general public?
So I think one of the biggest things that we see is individuals don't know when to start screening. So like I said in the beginning, like you should begin screening at the age of 21. Some people don't think they should start screening until they become sexually active. So I think that is something. And then I think people often think Women's Way is only for people that need breast cancer screenings. They forget that Women's Way covers breast and cervical. So those individuals under the age of like 40 typically aren't reaching out if they need financial assistance for cervical cancer screenings.
When you say individuals and screening, we are talking about both male and female, right, for the screening? Because when you said your organization, Women's Way, sometimes people would just think that it's the female only. The resources available are for female only. But from what you are saying, you have resources for all. Is that what I'm understanding?
Correct. So with like breast cancer screenings, we are able to serve men or males, as they can also get breast cancer. But we can also serve those that have transitioned or anything else as well. So yeah, it is available for both males and females.
What is Women's Way, and what is the program? What does it do, and what do we mean when you tell people go and seek services at Women's Way?
Sure. So yeah, Women's Way is the breast and cervical cancer early detection program. So Women's Way serves individuals between the ages of 21 and 64 who are in need of a breast or cervical cancer screening. And we're able to provide financial assistance to those individuals that would be eligible for the program. So they would have to meet certain criteria to be eligible for a free breast or cervical cancer screening. And they work directly with a local coordinator. So we have 10 local coordinating units throughout the state of North Dakota. So depending on which county you're from, you would work with a specific local coordinator in finding where to get your screenings, and then also how you would enroll in the program.
Very nice. And so overall, there is coverage throughout the state, you would assume, in terms of like where the 10 programs are located, or the outreach programs?
So Women's Way is available throughout the state of North Dakota, and we have over 150 providers. So Women's Way is easily accessible to a healthcare facility probably closest to you. However, since North Dakota is such a rural state, Women's Way also provides patient navigation services where we can help assist in reducing any barriers to screening. So if transportation is a barrier and you need some assistance finding transportation to a facility, we can also help kind of reduce any structural barriers that women may encounter with getting their breast or cervical cancer screening.
That's fantastic. See, I keep telling Grace, like, the more conversations we have with people, the more I learn about programs that I think I knew something about, but clearly I knew nothing about them.
Yeah.
So
Yeah.
that's fantastic.
Yeah, and like right now, which is kind of cool, Women's Way is able to provide like gas gift cards.
Yeah.
So if you have to travel a long distance, women can obtain a gas gift card. So, you know, it's not such a financial burden to just drive to the facility, because sometimes it is, you know, 50 to 100 miles to get to the nearest facility that can do mammography. And again, you don't have to record this part, but like there's no mobile mammography services on the western half of North Dakota anymore. They've cut funding for all of that. Mm-hmm. So like anywhere, like, so say you're down in like, I don't know, Hettinger, or, you know, kind of like in that area where it's really rural, or right. Probably more out by Williston. There's some really rural areas out there. Like, yeah, to find a place to do mammography could be a long ways away. And then the wait times too, since a lot of people are trying to get screenings there, sometimes you have to wait 3-4 months to even get in. Mm-hmm. So, yeah.
Thank you so much, Amy. This was obviously very informative and very helpful. So thank you for talking to us today.
Yes, and thanks for having me.
Thank you so much, Amy.